Hello, my name is Twyla Braze. I am president and co-founder of Citizens Council for Health Freedom, and you can consider this a little promo for our organization. Some people have wanted to have a more concise definition of what we do and who we are, and so I thought I'd share it with anybody who wanted to watch, and then anybody can share it after that. So, our organization, Citizens Council for Health Freedom, has been around for about 22 years, and I've been doing this work for about 25 years. I am co-founder, and I am a registered nurse. A little bit about our organization. We are based in Minnesota, but we do work at a national level as well as at a Minnesota level. And we are doing work in Washington, D.C., talking with members and their staff there, as well as here in Minnesota, and then talking to other policy organizations around the country. I think the good thing for you to know is that we are patient-centered, we are privacy-focused, and we believe in a free market. We really want the patient and the doctor to be free to work together for the benefit of the patient, because after all, the entire healthcare system was made for the patient. If there wasn't a patient, there wouldn't be a healthcare system. And so we're here to make sure that the patient stays primary in the healthcare system. We're a long way from that today, but we are working our way back to where the patient and the doctor can work together freely. They need to not only work together freely, but they need to work together affordably and without interference from third parties. That interference often comes through the electronic health record or through the data collection system, and that's one of the reasons that we are privacy focused, because we understand that only by protecting the privacy rights, the consent rights of patients, and the consent rights actually of physicians to not let all of their decisions become public information, by protecting those rights of the patients and the doctors, then we also protect their ability to work together without outside interference. Okay, we protect health freedom at two different levels. One is at the public health level, and one is at the private care and coverage level, because that's where health freedom comes or is lost. And so at the government level, we can see, fully today with what's happening with COVID-19, what it looks like when the public health officials take control of the country or a state or a population, and they claim public health or public safety purposes. Our organization supports limited government, and so we have been trying to bring truth into what's happening here today to give power to the people over the public health officials and their claims and their statements, and come up with the real data, the real science for you. So that's part of what our organization does. The other part of health freedom is what happens in the exam room with the doctor in the hospital. It's what happens with the coverage, so care and coverage. And so we work for freedom there and affordability there, because, and also even charity, the right for doctors to be able to give care for free or at a price that they wish to. That is freedom, and that's where freedom needs to go back to. All right, some of the projects that we do are the Wedge of Health Freedom, which is an online directory at jointhewedge.com, where you can find a doctor who takes only cash, check, or charge, doesn't take insurance, doesn't take Medicare, doesn't take Medicaid, works only for the patient, no outside interference, keeps the data all within the four walls. And so again, jointhewedge.com. We really believe in this type of medicine being expanded throughout the country. We believe in the doctors coming out of the health plans, out of employment, and working only for the patient. We've got a long way to go, but we are started down that road. Some of our other projects are the book that I've written, Big Brother in the Exam Room, which talks about the dangers of HIPAA and how it took away the controls out of the hands of the doctors and the patients by giving it all our data, including an attempt recently now with Google and the healthcare system to have Google have algorithms to in real time help direct the doctor's treatment decisions. So, our project to protect privacy and to bring back patient consent rights over anywhere and everywhere that their data goes is part of freedom. We also testify and meet with legislators. We have an entire campaign to help parents stop the government from taking their child's DNA. So we got this little campaign here. And you can go to itsmydna.com if you want to see more about that. We have a patient toolbox at patienttoolbox.org, which will help you with coercive situations in the exam room. We've got an entire campaign to get the truth out about HIPAA and to get people not to sign the HIPAA forms. And we have been working to give people, citizens, seniors, the rights to opt out of Medicare without losing access to their Social Security. It's not law, it's not a rule, it's the Social Security Administration that wrote it into an operations manual, and they've been following it for more than 20 years, and we need to stop that. So if you think about our organization and what we want to do, think about it as an organization that's looking for the Achilles heel of policy, and that's where we target our efforts, because that's where we feel that we can do the most and take the biggest steps toward freedom by targeting the things like privacy and privacy rights. We get privacy and privacy rights back. We will stop outsiders from controlling what happens in the exam room. So that's an Achilles heel. To get consent would be a wonderful thing for all American doctors and American patients, so that they can both work together. Henry Thoreau said, "There are thousands striking at the branches of evil to one who is striking at the root." Well, you can count on our organization to try to strike at the root and not just try to strike at the leaves, because unless you get the root, you haven't gotten anything. So thanks so much. I hope that gives you a little bit more information about our organization, and I feel free to contact us at any time, 651-646-8935, or go to our website at cchfreedom.org, cchfreedom.org. Thanks so much for joining me, and thanks for listening and supporting our work.